Hello, this is Sarfaz Niazi. This is my second update on COVID-19 in simple words. So there are few reports that came in and we're getting to understand this a little better. So first of all, I want to share that there is no selective spread of this virus. There are a lot of studies going on showing that perhaps genetic differences may have prevented some people from getting the virus. That is not the case. Virus doesn't have a mind of its own. It doesn't discriminate. It's just that it's not getting there today. A good example is Turkey and Russia. They were almost thinking they're done with it, and then it struck them. Also, it all depends on what is the traffic, of people coming in and out of the country. So I don't believe there is any genetic correlation with whether it hits somebody or not. Yes, of course, there are differences in how he hits the younger population versus the older population. And there could be a correlation with the climate. If the virus in a bright sunny places, it's more likely to be killed faster in the outdoor surfaces. But there is no certain understanding and how it will be spread. Second thing I want to share with you is very important is that if you have come out of the infection, most of you will be thinking that you have a lifeline immunity. Answer is absolutely not. Let me share with you the best virus that gives you lifetime immunity is chicken pox, and then you go down to H1N1, the SARS-1, and then the worst one, of course, is the HIV virus, for which there is no immunity, because once the virus mutates, it's a new virus. So this virus is a part of the SARS. This is called SARS-2. So we know enough about SARS-1, which has an immunity when you get infection from few months to maybe a couple of years. This virus, luckily, this virus has not been mutating as fast as many had feared. So I'm not willing to bet, but at least conjecture that you will have a few months or maybe a couple of years of immunity. Then either you will have to get a booster shot or be ready for another infection. But another important thing is this. The one study that came out 2 days ago says that a woman who recovered from coronavirus, and she died of heart attack, and then she was in an autopsy, she showed her lungs were filled with virus. So she was still infectious, even though her nasal swab test showed that there was no virus in the body. So now we're talking about a situation, where the people who are coming out of treatment, are they still infectious or not? They probably are, I don't know whether it will take 2 weeks, 3 weeks, 5 weeks. Also, we're finding out that some of the symptoms, let's say you had the infection and you fought it out, but some of the symptoms may last for a very long time, weeks and weeks. So don't be alarmed with that. That's part of this, how this virus behaves. One more thing we just found out a couple of days ago is that this virus can also affect, it's also jumping from lung to other tissues, kidneys and heart. There was a couple examples where children who got it had a kidney failure before the lungs became stuffed with the virus. So still we don't know where it will jump and how it will jump. There's also a lot of talk about how this virus started. Was it a bioweapon? Did China start it? Was it a leakage from the Wuhan lab? I think all these theories are absolutely absurd. I think the only thing that is holding today is that this is a mutation of one of the viruses that is known to mankind for a long time. Most likely, this is called species jumping, where the virus jumped from bat to humans, or some other species, animal species. So let's not waste our time and energies into finding out, who did what, but let's take care of what we can do from this point forward. Another misconception that I want to clear is that how it is being counted, okay? Countries like Netherlands are counting anybody who has a respiratory infection as a coronavirus patient. Others who don't have the diagnosis don't even count many people, okay? So the numbers you're seeing around the world, okay, are not very exact, at least at this point in time. However, whatever numbers we have, they tell us that worldwide, 8% of those who are infected end up losing their life versus about 5% in US, probably because of better healthcare or whatever you can name it. But certainly that number is holding up across the globe. So that brings me to the discussion, which is very interesting discussion, is what will happen if you do nothing? People have asked me, they are going out, opening everything up. So that data we really have very well. It's called herd immunity. A herd immunity is where if 50% or 60% of all those people that you'll be contacting with have had the infection and they've come out of it, then the chances of spreading it are minimal, 60% maybe. But to have the 60% people having infection and come out also means if you're losing 8% or 7% of them, okay? So it will be like losing 200 million people to the virus before the herd immunity takes over across the globe. And that number, surprisingly, I was very surprised when I did the calculation, is exactly the same number that happened in 1917 virus infection when we lost 60 million, which is close to 200 million today. Okay, so I think herd immunity is a possibility, but I wouldn't count on it. Okay, that this will take care of us. Next thing I want to talk about is how the vaccines are made. Now Harvard is doing an experiment on a DNA vaccine, and they're using an adenovirus, which is the safe kind of virus, okay, that goes in the body. But this strain of virus has two jobs. First of all, the body also reacts to virus, so there's immunity. And then the DNA it carries to make the protein is also reacting. So there is a good possibility vaccines like this may prove very useful, even though, keep in mind, DNA vaccines has never been approved by FDA. So somebody asked me, so what are the biggest challenges in bringing vaccines to the masses? You know what, as interesting as it may be, our biggest challenges will be availability of the commodity to bring it to people. Glass vials may not be available in sufficient quantity. I think this is the time for the governments, first of all, to believe that there will be vaccine. Secondly, to believe that it will probably be sooner than most people think because of the simplicity of this vaccine. We already know about the coronavirus 1 or SARS-1 virus. And secondly, all the novel applications. Are we ready to manufacture these vaccines in bulk quantities or not? I think there was a lot of goof-ups by many governments. I think this is the time to stock up on the supplies for manufacturing. Many countries have decided to ban export of components that might be used in the vaccine. So if you don't take a quick action now, you may end up in a situation where you may not have enough commodities to manufacture the vaccines. Other than that, I want you all to stay happy and healthy. This too shall pass, I'm sure, okay? But again, okay, don't jump to conclusions, okay? I think social distancing is the only solution that I can honestly suggest to you. Again, stay healthy and happy, and I'll see you soon.